Good evening. I'd like to welcome you to the August meeting of the Pitt County Board of Health. We'd like to start out, first of all, by welcoming our new board member, just appointed by the Pitt County Board of Commissioners, Mr. Rex Fleming. Mr. Fleming has served the community for quite a few years, was with the Pitt County Memorial Hospital for 30 years, retired in 2009, has also served with distinction as a volunteer fireman, as a fire chief in Station 14, as well as active in his church. So welcome very much.
Thank you.
Appreciate you being with us.
Thank you.
We'd also like, we have a special presentation and a resolution tonight to a board member, former board member who has served with us for many decades, and that's Dr. Tom Johnson. And we have a special resolution presentation for him tonight. The resolution goes as follows. Resolution of appreciation honoring Dr. Tom Johnson. The Pitt County Board of Health unanimously adopts the following resolution. Whereas Dr. Johnson was originally appointed to the Pitt County Board of Health on March 16, 1989, and has served this board for 12 terms and over 24 years. Whereas in 1994, Dr. Johnson helped make possible the construction of a new public health building, improving services to the community. Whereas in 2011, Dr. Johnson championed the cause of naming this new building the Earl Trevathan Jr. MD Public Health Center. Whereas Dr. Johnson has given unselfishly of his expertise, his wisdom, his time, and effort to the mission of the Pitt County Health Department to protect, to promote, and assure the health of all people in Pitt County. Now, therefore, be it resolved that the entire Pitt County Board of Health expresses to Dr. Tom Johnson its sincere appreciation for his many years of dedicated service to the Pitt County Health Department and to all people of Pitt County. Approved this 11th day of August, 2015. I have a motion to approve this resolution. Is there a second?
I second.
Second. All right, any further discussion? All in favor say aye.
Aye.
Any opposed? Okay, congratulations, Dr. Johnson. Hey, Dr. Johnson, if you'll come forward. We have a plaque with the resolution that we just read and approved as a small token of our appreciation for your many decades of service.
Thank you.
You're welcome. Yes, sir.
Thank you, Dr. Johnson. We really appreciate all the help you've given us over the years. I know when I came here in '97, you were already on the board then and served so many terms for the board through those years. And there's so much to look back on that you've had a piece of in terms of improving the health for our citizens. So I want to personally thank you. Give you the opportunity to say a few words if you'd like.
Well, I will speak briefly. First of all, I appreciate what this board is doing tonight. And I was concerned way back when the health department was working out of the old building adjacent to the current building, this building. And I was able to get support from Linwood Mercer to convince the Board of Commissioners to build a new building. And we did it. And we were forced to build a building for mental health. And Linwood Mercer and I felt that to build that building and not Board of Health would be a mistake. And so we got enough support. And the building now stands. And I'm very proud of that. It's my personal feeling that many citizens in the county of Pitt will benefit that Board of Health building. And every day you can see the activity going on. And so I'm especially appreciative.
Very good. And thank you again for making that happen.
Okay. Thank you again.
Yes, sir.
Thank you, Doctor.
Thank you.
Thank you.
Thank you.
So, John, before we get to your report, are there any public comments? Okay, hearing none. Let's go ahead and approve the minutes of the previous meeting. Those were distributed to you in advance, and if you've had an opportunity to take a look at those, are there any corrections or additions to those minutes? Hearing none, is there a motion for approval?
Motion to approve.
Or a second over here? Any further discussion? All in favor say aye.
Aye.
All right, the minutes are approved. And now for the fiscal report, John Reed.
Thank you, Mr. Chairman. Board members, you have several reports in your packet tonight. The first report I'll go over is the July 31st, 2015 financial report. We are in, July is the first month of our fiscal year, so we're now just beginning of our fiscal year, and the report shows that the adopted budget, the far left-hand column, the adopted budget for the health department is $9,764,000. Since that budget was adopted, we've actually increased the budget by $25,200 to take us up to $9,789,000. The pro rata column you see on that report is a 1/12 of the annual budget. So it assumes that, erroneously, that all the revenue and expenditures are incurred evenly 1/12 each month. So that just kind of gives us a baseline to compare the actual results at any point in time during the year. So 1/12 of that $9,789,000 is about $816,000. So in a perfect world, we would realize 1/12 of our annual revenue each month and 1/12 of our expenditures. Obviously, it doesn't happen like that. You can see the column year-to-date, July 31st, 2015, we've brought in $1,289,000 versus expenditures of $581,000, resulting in a one-month surplus of $708,000. Obviously, there's some timing items there. And in the timing column, I have added in the timing column the pro rata portion of our Medicaid cost settlement. Now, this is the settlement that we get late in the fiscal year, so I just brought in each month, I'll bring in 1/12 of that until we actually receive it. Move further down the line, you see $90,700 addition to revenue. That relates to state revenue we earned in July, but we won't receive until August. Then you see a negative $752,000. The county at the beginning of each quarter transfers 1/4 of the annual appropriations to the health department. I've backed out 2 months of that to match it up to our expenditures. So once you take into those timing items, our revenue is $680,000 again, bumped against expenditures of $581,000. So we've got about a $99,000 surplus at the beginning of the fiscal year. That will fluctuate as we move through the year. There's not much to report at this point in time with 1 month's operation. But I'll be glad to answer any questions that you may have on this fiscal report.
John, the 20,000 Ebola preparedness, was that something you were expecting, we were applying for, or?
We were expecting that from the state. We knew we were going to get it a few months ago, but we didn't have time to get it in the current year budget by the time it got adopted. Knowing we weren't going to spend it until July anyway, we waited till now to put it in the budget.
John, is the Ebola preparedness, is that a one-time
It is.
appropriation, or?
It is.
Okay. Does anybody have any other questions or for John?
I just mentioned we're still waiting to hear from from Medicaid on our cost settlement.
Right. And I can report on this, the final results of 2015 are now in, and you have that report too. As that report shows, not only did we not have to use any of our fund balance, we had budgeted $371,000 of fund balance to support operations in 2015. Not only did we not have to use any of that money, as I've told you previously, we actually had a surplus of $554,000, which we added to our fund balance. So that takes our fund balance up to almost $1,008,000, $1,797,000 at the beginning of this fiscal year. The one caveat that Dr. Morrow did mention is you'll see the third line down in the revenue section of that report, the Medicaid cost study, the $708,000. We have not received that as of yet. That's still outstanding. We don't have any indication that we won't get it. It's just the state and Medicaid are going through a process to get us that money. So I think we had financially we had a pretty good year. We added to our fund balance. A lot of that savings came from, we had vacant positions throughout the year. We had some retirees, and it takes 2 months, sometimes longer, to get those vacancies filled, and that just generates lapsed salary and fringes, which is good on the financial side. The bad side is you don't have those man hours, those staff hours to fulfill the mission of the health department, so everybody has to work a little harder.
I see that your state funding for last year fell short of your budget projection. How do you know how much state funding you're going to get this year? I mean, is that just an estimate and you're not quite sure what your funding is going to be?
No, for every program that we have state funding for, all those programs are, they reimburse us for the expenses we incur the next month. So we have a hard number from the state for each program. The reason the state funding fell short of our projection is we actually didn't incur the expenditures to draw down that state funding. So you have a negative variance on the revenue side. You also have a negative variance on the expenditure side.
Okay.
One other thing is we do have a number of other grants and programs that the health department administers, we oversee, and I just wanted to put to show you this on this other slide. We had 5 grant programs outside the typical health department portfolio, and those 5 grant programs, almost by definition, the revenue is going to equal the expenditure. So that added about another $646,000 to our budget that we had to look after. And I just wanted to get those, present that to you. I usually try to do that a couple of times a year just to show you the expenditures related to those.
And those are competitive grants, by the way.
They are,
Right.
yes.
A lot of work went into, by the staff into earning those grants, so.
And some of those grants, even though we don't pay a lot of attention to them financially at these board meetings, they take a tremendous amount of work by many of our staff overseeing these grants. The last thing on my report tonight is our annual bad debt write-off. What we do as of June the 30th of every year, we look at all the accounts that have had no activity for the previous 2 years. That means we've received no payment, we've provided no service. We send statements out quarterly to folks, but for the last 2 years, we've had no activity on these accounts. It's 206 accounts. The average balance per account of those 206 accounts is $63.75. The largest balance we're asking to write off tonight is $682, and the smallest one is $1.14. The total write-off is $13,132. To give you some perspective, and in fact, I had to run these reports a couple of times just to satisfy myself. That number seemed very low to me. That's the right number. Last year at this time, we were requesting to write off $43,000. So it's a significant decrease in our request to write off accounts. And it does save us money. We don't have to send out 206 letters every quarter. We have gone through the North Carolina debt set-off process for all these accounts at least twice now. So I think we've done our due diligence in trying to collect. So I'm asking this board not only to accept the financial reports, but also approve this write-off. If you approve it, we will take it to the Board of County Commissioners for their approval at the next available meeting.
Any further questions, or is there a motion for approval?
Like to make a motion and the write-off.
Is there a second?
Second.
All right. Any further discussion? All in favor say aye.
Aye.
Any opposed? All right, your motion's approved. Just for any of those in the public that may be watching for the first time, we have a yearly budget, but we also approve each monthly report from Mr. Reed to ensure that we're spending our money both wisely and as per the allocations from the County Board of Health.
Thanks, sir.
Board of Commissioners, sorry. Okay, if there's no further business, we'll move on to old business. The Community Health Needs Assessment update is going to be given by Amy Haddam, the Health Education Director.
Good evening. I'm glad to be back with y'all tonight. As you recall, your last meeting last month, I gave you all the stats from our community listening sessions and all the data we've collected for our 2015 Community Health Assessment. Tonight, I'm going to do something a little different, give you a timeline of where we've been and where we are now and where we are going to go from here. Do want to remind you and the community that the Community Health Assessment is very much a collaborative process, and the partners that are involved in this are our Pitt Partners for Health, Pitt County Health Department, Vidant Medical Center, East Carolina University, and I think the most important would be our community members that have had a lot of input with this report, with this assessment. Moving on to the timeline, we did start back in 2014. A lot of work was done in 2014. Planning meetings were held among Pitt Partners for Health steering committee members throughout the year. And those meetings were to discuss the best way to conduct the 2015 assessment. And then after that, in December of 2014, we invited numerous key leaders in our community to come together as a kickoff for the community health assessment, and to also collect feedback from our leaders as regarding what they felt their needs, the Pitt County's needs, health needs were for the community. Moving into the 2015 timeline, as you recall, secondary data related to Pitt County's leading causes of death and illness was collected and analyzed between January and June of this year. In addition, an online community survey was made available to all community members between January to March of 2015. We were very fortunate. We collected over 500 surveys. 545 members of the community completed the survey and provided feedback regarding their opinion of the community's health. Then between January to May, feedback was collected from 291 community members who participated in community listening sessions, and we were able to conduct 20 sessions throughout the community between that time frame. After that, the secondary data and feedback collected from the community survey and the listening sessions was presented to Pitt Partners for Health, Vidant Medical Center Board of Trustees, Vidant Medical Center Community Benefits Foundation, and also to the Board of Health last month, and that was all between May and August. And then based upon the information shared during those sessions, health priorities were selected between June and August. Matter of fact, our last meeting was with the Community Benefits Foundation at Vidant Medical Center last week. And those priority areas will be addressed over the next 3 years. So the selection of the priority areas. Pitt Partners for Health, Vidant Medical Center Board of Trustees, and the Community Benefits Foundation selected priority areas. And as you see, they selected access to care, chronic disease prevention, and physical activity and nutrition. This board, last month in July, selected maternal and child health, sexually transmitted diseases, tobacco prevention and control. And although public health will focus on these 3 areas, we will continue to partner with Pitt Partners for Health to also address the areas that were selected by that group. So our final timeline for 2015. The final Community Health Needs Assessment document is now being compiled and will be completed in September. Although public health's deadline is really not until March of 2016, the hospital's deadline, according to the IRS, is actually September 30th of this year, of 2015. So the full document will be completed and posted on both the health department's website and the hospital's website by September the 30th. Then we also have a 2016 timeline. So this is where the work begins, where we try to implement our plans to improve the health of Pitt County's community over the next 3 years. So Vidant Medical Center will develop their plans for the needs assessment by February of 2016. Public Health will develop a plan of action for each of the priority areas that were selected, and we are due to submit those to the state by March of 2016. And of course, community members are all invited to get involved in this process by joining Pitt Partners for Health. We would love more community members to join us. And here's my contact information for the community if anyone would like to contact us to see how to get involved with Pitt Partners for Health and with the Community Health and Needs process. Any questions?
Okay, so sure nobody has any questions for Amy, so.
Time is drawing near. We're getting ready to
That's
finish
right.
the final document and then put our action plans in place by March. So it's been a long process, but we've learned a lot along the way and ready to get started.
Very good. Do we have to approve this order?
No, there's nothing to approve tonight, Mr. Chairman. We just wanted to update you on where we've been. Since the last meeting, we've presented particularly to the hospital boards, and I think we had a very positive reception and
Yes.
at those events, and we're looking forward to the work that's ahead. But I want to applaud at Amy. She's really done yeoman's work on getting us through accreditation this year, and then taking off on this community health needs assessment. She's done a whole lot of work along with the rest of the staff, particularly Amy's staff, helping us get through this. But I think as we look at maternal and child health and sexually transmitted diseases, we're going to hear more about STDs tonight from Kimberly Hardy. We know that we have a lot of work to do in those areas, and also in tobacco control too. So the board will really get busy on those things as we get into the implementation plan later this fall and even into the spring of
And
next
part of
year.
our accreditation process, those action plans will have to be approved by this board, so we'll be bringing those plans back to y'all.
Well, very good. Thank you very much.
Thank you.
We'll look forward to seeing those. Is there any other old business? If not, we'll move on to new business. The Communicable Disease Annual Report will be given by Kimberly Hardy.
Good evening, Chairman and members of the board. I would like to provide you with a communicable disease report giving information regarding the year of 2014. And I'd like to start saying at the outset that the report reflects the hard, diligent work of many of our staff members at the Pitt County Health Department. Last year, I wanted to make sure I took the opportunity to share some information about the communicable disease program at the health department so that we could use this meeting as it re-airs over and over again as a moment to educate our community regarding our services at the health department. We want to make sure that everyone knows that communicable disease is mandated in our North Carolina law and North Carolina General Statutes, Chapter 138, Article 6, that gives our health director the authority to conduct investigation and do the work that we do with communicable disease. The objectives of our program include the control the transmission of communicable diseases with appropriate prevention and treatment, detect cases of communicable disease in the community, and monitor the incidence of new communicable disease cases. In addition, we are responsible for the surveillance of reportable communicable diseases, whether it's submitted to us via paper reporting or via our NCEDS or the North Carolina Electronic Disease Surveillance System. Either environment, we're responsible for doing the surveillance. And we're also responsible for prompt investigation of communicable disease cases, whether they're probable, suspect, or confirmed, and in the case of outbreaks. I specify that, and you'll see in the data that I present in terms of the 3 different types of cases that are reported to us, because we have to investigate all of those, whether they're confirmed or not, and that reflects time that staff uses to complete that process. Our services also include implementation of control measures. We provide post-exposure prophylaxis, and we also provide health education to the community to enhance our disease control efforts. We maintain communication with our public health agencies, whether they're this county or outside of our county, private physician offices, hospital and occupational infection control personnel. In addition to that, we have a 24-hour, 7-day-a-week communicable disease response line where providers can report communicable diseases, and we are prepared to respond. This year, I thought I would present this information hopefully a little bit in a more meaningful way so that you could get a feel for what is actually going on in our community and the types of diseases that we are actually working. As you can see by this graph, 62% of the communicable disease cases that were confirmed in 2014 were related to foodborne illness. 18% was related to bloodborne illnesses such as hepatitis B and hepatitis C. 13% was vaccine-preventable diseases. 5% contact, 3% waterborne, and 2% vector-borne. Further down the report, I'll give a little more information about each one of those categories. Demographics of our CD cases. I don't think we've reported this information before, but I thought it would be good for us to see that actually our most vulnerable populations comprise a large number of the cases of communicable disease. So we notice that we have a good opportunity to target our education efforts towards these populations. So based on this graph, you see a large number of our population from less than 24 years of age have a higher incidence of communicable disease, especially the 1 to 14-year age range. And then you see the 50 and above is the next highest category. The demographic distribution for our CD cases, this is again new information. 54% of our cases were female. And this, when I mention communicable disease in the front part of this report, communicable disease includes generally HIV, syphilis, STD, and vaccine-preventable diseases and regular communicable diseases. However, for the purpose of this reporting, I'm speaking specifically regarding communicable diseases. We will break out the STD, HIV, and syphilis a little bit later on in the report. 63% of the population that had communicable disease were Caucasian, 30% were African American, and 7% we didn't know, it wasn't reported. And in terms of Latino ethnicity, 77% were not ethnically associated with that category. The total number of CD confirmed cases, was 115. As far as vaccine preventable cases go, you see a little bit of a different spread. The total number is not as high, but you still see that our highest number of vulnerable population would be our young, teen and younger, and our 40 and older range. The demographic distribution for vaccine preventable diseases, as you can see here, 64% were male, 46% were African American, 18% Asian, 25% Caucasian, 11% was not reported, so we're not sure what their race was. And Latino ethnicity, actually we didn't have data on 46%, but 50% was not ethnically related to that category. There were a total of 28 vaccine preventable diseases reported last year. And I will say that the large majority of that, before we get too excited, was hepatitis B. So we didn't have huge numbers of other things that are very communicable. Now, the following diseases require the most time, and I've alluded to this before. Even if we didn't have confirmed cases, if we had probable or suspect, they still require time and attention by our staff. So we have foodborne diseases, bloodborne, and vector-borne. As you can see here for hepatitis B, we monitor the reporting of that. So we had one acute case reported in 2014, one suspect, and then we had 15 chronic. As you look at this comparatively over the years, there hasn't been a large change in the number of acute cases, and from 2013, we actually decreased by 2. Hepatitis C, we have 19 chronic and 3 acute. Those numbers are coming down a bit. I'm going to take this moment again, because foodborne diseases require most of our follow-up time. We want to take this moment to give a plug for hand washing, proper food storage and handling, and cooking. It's the best way to prevent diseases in that category. Campylobacter infection, I stacked this chart because I wanted to again highlight the fact that even if the case was not confirmed, it required work from our staff. So in compared to 2013, you haven't seen a large change in the numbers. 2012, you saw the largest number there, but we have come down with that. So perhaps the message is getting out about hand washing and proper food storage and handling. Salmonella, again, we've remained pretty consistent over the last few years with those number of cases. Shigellosis, in 2014, we had a pretty high resurgence of that. We had the highest number of cases that we've actually had. Vector-borne diseases, they include Rocky Mountain spotted fever, Lyme disease, and ehrlichiosis. Rocky Mountain spotted fever, we only had 1 confirmed case in 2014 compared to 11 in 2013, so we've experienced a significant decrease in that disease. Lyme disease, same case here, only 1 in 2014. Ehrlichiosis, none. Now, moving forward, we mentioned Ebola during the budget report. Ebola for Pitt County is still a concern. We have not had anyone in our county. Fortunately, of course, you haven't heard anything on the news about having anyone here that has that disease, but we want to make sure that you are aware that our health department is responsible for monitoring all Ebola travelers that come within our jurisdiction. We have had several cases that we have monitored here. This is still a disease of concern. Chikungunya, many of you are aware of this. You heard of this on the news. It is spread by mosquito bites. You have heard a lot of the information regarding making sure we don't have the water in our standing water in our yards and that type of thing. We have not had any cases that originated here in Pitt County. However, we do have the mosquitoes that breed this or spread this virus. So this is still of concern for us, and we are monitoring the incidence of this disease. We have had people who have traveled back from the countries where this is currently prevalent, but we have not had any cases originate here. Immunization program. The goal of this program is to reduce the spread of vaccine-preventable diseases by ensuring individuals are age-appropriately immunized. We also manage outbreaks of vaccine-preventable diseases, and we provide education to our community to improve our immunization rates and to improve protection via cocooning. Immunization program services. We offer immunizations at our health department at no cost to VFC eligible children. We also bill Blue Cross and Blue Shield for immunizations. And we do have immunizations for adults. The costs vary. Some are at no cost to our patients, and some are for pay upfront service. We also provide post-exposure prophylaxis for rabies. Our benchmarks for our immunization program, as many of our benchmarks come from DPH. 90% of all eligible 2-year-old children served by our local health department will have documentation of age-appropriate immunizations in our North Carolina Immunization Registry. Our current health department rate is 95%, so we have met that benchmark. We do this by collaborating again with Pitt County school nurses, our public and private schools, daycares, Pitt County physicians. All of those collaborations help to increase this rate. At least 79% of all eligible 2-year-old children residing in the county will have documentation of age-appropriate immunizations in NCIR. Currently, our county rate is at 75%, so we have a little room for growth on that. I'm going to kind of skip through some of this just to make sure I allow enough time for our next report, but basically we are on target with our immunization benchmarks. STD program services. Our health department provides confidential STD exams, testing, treatment, and counseling. We also refer for treatment for services that exceed the scope of practice for our enhanced role registered nurses who primarily provide services in that clinic, and for our advanced practice nurses. We monitor rates. Again, many of the things that are present in the communicable disease program at large are also going to be true for each program as I go through them. With the STD program, we ensure adequate treatment for all patients seen in Pitt County, whether they're seen in our agency or in the private sector. Through our North Carolina disease surveillance program, electronic disease surveillance system, we have access to all of those records, and we make sure that we monitor the treatment. This is a little bit of a different picture than you guys are used to seeing, but I just wanted to show you the diseases that are most concerning our community. Obviously, if you have one disease, you're at risk for the others. But 79% of the cases reported in our North Carolina electronic disease surveillance system were related to chlamydia. 20% was related to gonorrhea. 1% was NGU, and less than 1% was related to PID. Our total number of cases for STDs in Pitt County in 2014 was 1,948. Our demographic distribution for STD, and you would focus more primarily on the right-hand side of this slide. It's a little busy, but it allows us to not have so many individual slides. Our largest population in relation to gender is female, 71%, with males at 29%. Our largest population in terms of ethnicity or race is 68% African American and 24% Caucasian. 7% we don't have reporting. In terms of Latino ethnicity, we have 89% no and 4% were Latino. Now, and I'm going to skip over these next few slides because they actually restate exactly what I just said. Chlamydia incidence. Showing the trends from 2010 to 2014, the chlamydia rates have not significantly changed, especially over for 2012, 13, and 14. Gonorrhea rates, you can see we had a pretty high rate back in 2010, 2011, and we've dropped a bit for 2014. Actually, excuse me, we dropped a bit in 2013, and we had a resurgence in 2014. Whether that's due to increased testing or health behaviors, we really can't speak to that. HIV services, We also provide, in terms of our STD screening, we provide syphilis and HIV seropositive counseling, follow-up, and referral. Our disease intervention specialists provide investigation of disease control measure violators. And we also provide HIV and syphilis partner notification services through the DIS workers. You can see that with our next slide, our HIV cases have increased over the last 3 years. This year we had 45 new cases of HIV reported. While we have an increase in HIV, we have a decrease in the number of AIDS cases. We have had an increase in syphilis rates across the state. You can see that we've kind of had a rebound effect from 2012, and we've increased in that category. We had 37 cases last year. Moving on to TB. Our goal is, with all the diseases, is to eliminate them. We want to eliminate tuberculosis as a public health threat. We want to decrease the number of new cases and also control the spread of tuberculosis. We provide surveillance again. And one thing that is probably special to the TB program, we provide directly observed therapy, treatment of contacts, and isolation, and other control measures. A lot of times this involves home visits. I've mentioned this probably the last 3 years, so I won't stay here long, but just to make mention that we have continued to experience a decrease in the number of TB disease across the country and in North Carolina. Our TB program benchmarks, this slide is another one that's busy, but if you just focus on the actual column to the right, you will see that we've actually exceeded our benchmarks in several categories. The population that we serve is transient. A lot of times their contact information changes, so when you look at this graph and you look, chart, and you look at the bottom benchmark, you will see that we're a little bit below our projected goal, but it is related to our contact information with our clients. And here's more data. It's really too comprehensive to actually read each part, but I just wanted to give you a sampling of what actually is on the report.
Kimberly, I just was thinking, was Connie Yarnell's last day today?
Yes, I was going to mention that too.
Connie's been our tuberculosis nurse for a number of years, and she's retiring right now. So we need to make sure that we've trained her back up well, and that we can pick off where she left off in terms of those tuberculosis rates. But she's done an outstanding job. We really hate to lose her.
She's been with us for about 16 years, and she has managed this program for a number of years. And I really can't stress enough what he said, and I really want to say it again. One of the things that Connie made us aware of as she was leaving is that although our TB rates have decreased, we have actually doubled the number of TB cases in 2015 over what we experienced in 2014. So the importance of having staff in this role is critical for the control of this disease. Our program focus for communicable disease overall we've had different initiatives over the last 3 years. In 2013-14, we worked to improve access to care by adding walk-in clinics for STD services or select services. We include immunizations, contraception, things like that. In 2014-15, through the PIXI grant, we actually had education sessions in the community with the religious community. I remember the first year I came here and some board members asked some questions about, what are you doing about the STD rate? Well, we did something about it. We went out and we started an initiative and a partnership with the religious community. In 2015-16, our focus will be to continue to try to improve our patients, the quality of the experience that our patients have with access to our agency, whether it's on the phone, in person, or even in home visits. We want to improve the patient wait times when they're calling to access services, trying to get in the building, but also to improve their wait times once they are actually inside of our agency. And we also are aiming to improve the billing process. and we've actually started doing that. Major accomplishments for 2014 that I haven't mentioned so far is we added a second walk-in clinic, so we have walk-in clinics on Monday and Wednesday now. And I just mentioned this one, so I will not read it. That was a community initiative that we had with the religious community. And the last major accomplishment was that we received $15,000 from DPH in December, which we used to purchase billboard flights to educate the community regarding immunization requirements. Tdap is now required in the 6th grade, and Menactre is another new requirement as well. So we gave that information to our community. All right. I have already said these things, so I won't go over this slide. Are there any questions?
Just excellent presentation. Thank you very much, Kimberly. Among the vaccine preventable diseases, do you have a listing of those, or just
I do.
sort of
Are you wanting me to? We had 4 cases of pertussis last year. The rest of those that were reported were all hepatitis B.
hepatitis B?
Mhm.
Okay. Yeah, influenza's not, still not reportable, and we would have a lot of those because of the mismatch of the vaccine. But I will put a plug in. The flu vaccine is now becoming available in your local pharmacies, and I know the hospital, we just got our supply in. Thank goodness. And so just a pitch, it's not too early to get your flu shot. And someone asked me at work yesterday, well, Dr. Ramsey, if I get my flu shot now, will it be good, still in January and February to protect me and my family against flu? And I asked her, I said, how long have you been married? She said 28 years. I said, well, that's an old wives' tale that if you get your shot now, it won't protect you in the winter and spring. The flu vaccine is effective for a year, and of course that's assuming now we get a good match this year, and we certainly hope we will. But if you get your shot in August, it will still, and September, it will still protect you during our usual peak of the flu season in November, December, January, February. So I encourage you to go ahead. Don't wait. Go ahead and get your flu shot.
I just want to add one more thing. We did have 2 cases of influenza death last year, so that is also included in that vaccine preventable disease.
Okay.
Thank you.
Is there any other new business? If not, we'll move on to the health director's report. Dr.
Okay,
Martin?
thank you, Mr. Chairman. I wanted to thank the staff for their presentations tonight, first of all, but also want to bring you up to date on sort of what's going on with public health departments across the state and also across the country. You have a handout tonight that I passed you that's an article entitled Americans Endangered by Cuts to Local Health Department. This was written by Dr. Hasbrook, who's with the National Association of County and City Health Officials, but he makes a comparison with fire departments and the need to adequately train folks around public health. Medicaid reform is a hot topic today. I had an opportunity to hear a little bit of the discussion from the North Carolina Senate this afternoon as they took up a Medicaid reform bill. The Senate originally had Medicaid reform, you may remember, as part of the budget bill. They pulled that out about a week or so ago, and so a new bill was presented today, House Bill 372, where they discussed Medicaid reform, and you also have a handout that has a summary of what the Senate has proposed. But some of the things they had proposed in that bill are full risk capitated payments to commercial insurers, creating a Department of Medicaid, and a joint legislative oversight committee. That bill late today passed the Senate, so it will go back. It was passed on the 3rd reading by the Senate, and now we'll go back to the House
for concurrence. If the House concurs with that, then I'm assuming that the governor will sign that bill into law. There are a lot of, I think, issues included. Part of the elimination of the community care of North Carolina is included in that bill, and that would, I think, at least the contract with Medicaid and community care of North Carolina would expire, according to that bill, April 30th of next year. So I'm sure there's a lot of discussion that's going to take place back in the House when the bill gets over there, and a lot of concerns that I think we have. I'll just mention there was an amendment made to the bill today to expand Medicaid. That amendment failed by a pretty good majority, but then the bill did pass on its own without the amendment. So a lot of activity still going on around privatization of on-site services for local health departments, but we don't really have any news about that yet. They were supposed to take that up today, but I don't think it got done today, so that may come up tomorrow's session. But we hope that they will refer that back to the state public health board or the Commission for Public Health to change those rules rather than trying to change them through legislation, but we'll have to wait and see. And then I just also, Kim had just mentioned Ebola still being around. I don't want people to forget that we still have Ebola in West Africa, and particularly in the countries of Guinea and Sierra Leone. Liberia is much improved, but we are still monitoring that situation. We were dealing with a traveler just within the last few weeks here in Pitt County that we were monitoring. There's also concern about MERS, the Middle Eastern Respiratory Syndrome. They've had an outbreak in both in the Middle East and now in Korea, South Korea particularly. We had an exercise last week at our health department to prepare our staff to deal with a MERS case should it present. A lot of these diseases are, literally just one airplane ride away and could be here within 24 hours. So we need to be prepared to deal with that. There's people may have heard recently on the news about the Legionella outbreak in New York City and the South Bronx. There have been 113 cases and 12 deaths related to that disease. I heard just today that GlaxoSmithKline company in Zebulon was shut down today because of finding Legionella in their cooling towers for the air conditioning system. Don't think there's any, as far as we know, there's not been anybody that's become ill from that or any threat to their product, but I think they took a very cautious step to close the plant down until they removed that infection from their cooling towers. So that's apparently what's caused the illnesses and the deaths in New York City also. We've also had an outbreak of cyclosporiasis this summer in several states, including Texas and Georgia. That was related to cilantro being served in some restaurants. We've got outbreaks of salmonella from raw and frozen chicken, two major manufacturers across the United States with that the CDC is investigating presently. So just a reminder to folks that these outbreaks are out there every day, and we've got to have local health departments that are appropriately staffed and prepared to deal with these things should they arise. So it is much like a fire department. You can't wait until the fire is burning to go find firemen and train them. We've got to be ready before it happens. Also just like to share a couple of things with you. Our nutrition division asked me to let folks know that there is a World Breastfeeding Celebration. World Breastfeeding Week was last week actually, but in Pitt County we've
made a month out of it, so we're celebrating breastfeeding for the whole month. Our staff's been involved in several activities around breastfeeding. The biggest one will be this Saturday, August 15th, from 10 a.m. to 2 p.m. at the Pitt County Agricultural Center, and they'll have healthy foods and door prizes and personal stories, lots of activities for children and moms alike. So hope folks will come out to that, and that's, again, Saturday at 10 o'clock at the Pitt County Agricultural Center. Robin Tanner, our nutrition director, asked me to convey that the WIC audit, we were audited by the state. They did have several findings. We did a corrective action plan, and that has been accepted by the state. So we think we're back in good shape there. We have submitted a letter of intent to Blue Cross Blue Shield Foundation for grants around diabetes prevention. This is a community-centered health home model that we're working with, and we'll submit a full proposal later this month to that foundation for hopefully another competitive grant that'll keep Mr. Reed even busier than he already is. And lastly, I'd just like to congratulate one of our employees, Joan Mansfield. Joan Mansfield is a nutritionist in the Nutrition WIC division. She was earned her credentials as a certified diabetes educator, and our diabetes self-management program has been re-recognized by the American Diabetes Association, so that'll be good for another 4 years. So another good example of good work done by our staff. And that's it, Mr. Chairman.
Very good. Does anybody have any questions for Dr. Morrow? So, a lot of good work done, a lot of good work left to do, so. Is there any other further business tonight? If not, is there a motion to adjourn?
So moved.
Is there a second?
Second.
All in favor? All right. Drive careful. Thank you very much.